Today on behalf of both the AMA and also as a fellow orthopedic surgeon to speak to the California Orthopaedic Association. Big kudos to Lindsay and Alexa and Dory for putting on really such a fantastic meeting. You know, I was struck by the last conversation about moral injury and burnout, and I was specifically struck by some of the commentary by the audience, recognizing that these are things that are occurring within our environment as physicians that cause us to really react in a negative way to our environmental struggles. And to me, this speaks all to not only, one, being a victim to some of the external environment, but also the question of what are we going to do about it. And so now we're in a session about advocacy, and all of the things that we talked about in the last panel really, I think, are directly relevant to what we as physicians can and should do about it. I have a later talk to talk about some of the federal priorities that both the AMA and the Academy share when it comes to actually working through legislation in Washington. But for this talk, I wanted to just give a context for why it is that I personally am also involved in aspects of advocacy and why it is so important that I think every one of us work together to try to figure out what it is we can do about things like moral injury and the systemness that continues to bother us. And so in looking at the context of what's happening, you have to look at, you can't pick up the paper today without seeing some element of something that's happening in healthcare that relates to our practice, whether it's in one of these categories. These are categories that I kind of pulled off the top of my head just in a brainstorming session to how I was going to frame this discussion today. It's around financial dynamics. It's about the patient experience. We talked a little bit about consumerism, what's driving that, how it impacts us as physicians. We see lots of discussion, particularly today, around the FTC, antitrust, non-competes, what's happening in the labor laws, and how does that affect us in the practice. Market consolidation has happened. It's been going on for decades, and it's really raising questions now whether it was a good movement, and all of those system effects have really had an impact.